In our daily living and ordinary works like walking, driving, cooking, working, crossing the streets, we always use our eyes. But are we knowledgeable enough about these complications? Here, we will know about all of this. Let's talk about eyes first. The parts of the eye. The cornea, which covers the front of the eyeball. Pupil, the opening center of the eye. Lens, which allows the eye to adjust its focus with the object's distance. Iris, which gives the eye its color. Vitreous humor, a clear jelly-like substance which helps maintain the eye shape. Retina, the photoreceptor. End of nerve. Aming nakapanayam ang isang residente ng Lucena kung saan nakakaranas hanggang ngayon ng isa sa mga komplikasyon sa mata.
Ako si Jaime, ang edad ko ay 45 years old. Ako'y 6 na taon nang nagsimula ng mawala ng paningin. Ako'y 6 na taon na nagkasakit ng tikdas. Sa loob na 1 linggo, pawala ang aking paningin. Sa loob ng 39 years na hindi na ako makakakita.
Alam mo nararamdaman mo?
Para na rin akong nakakaano ng liwanag. Kaya so like, siyempre iba yung may panit, iba ngayon nang wala.
Upang magkaroon ng kaalaman sa mga komplikasyon sa mata, minabuti namin kausapin si Dr. Maribel Badjola Lozada, isang optometrist.
There are 4 common visual defects. Number 1 is farsightedness. Farsightedness is the ability of the patient to see clearly at distance without correction or without eyeglasses. So good vision at far. What are the signs and symptoms of being farsighted? If the patient complains that I'm alright at distance, I'm alright at far, but I cannot stay long hours of reading. When working on a computer, after an hour, I feel so tired. So those are the symptoms of being farsighted. It may also be accompanied by headaches, eye twitching, glaring. How is farsightedness corrected? Farsightedness is corrected by plus lenses or the so-called convex lenses. Like this. A convex lens, the lens correction for being or for farsighted patients.
Maria Mendoza Minor, 57 years old. High school mo, second year high school ako.
Alam niyo ba yung sinasabi ko?
Hindi naman nila may
Nagsusuka ako.
Tapos may set of questionnaire.
Simula noon hanggang ngayon, pataas ng pataas.
O kaya yun ang tatanong niyo.
Yung grado. Sa baba, double vision ako. Sa baba, pag ako'y walang salamin, hindi ako makakita. Pag sa taas, pag wala ako salamin, hindi na ako makakita.
Nearsightedness, or we call myopia. Myopia, the inability of the lens of the eyes to see clearly at distance. Patient who is nearsighted loves near work, sees clearly at near, but have difficulty when looking at distance. So he can't drive well. Nearsightedness has signs and symptoms like squinting when looking at distance. May also be accompanied with headaches, sometimes vomiting, sometimes with nausea. Nearsightedness may also be accompanied with dizziness. Nearsighted si yan. At magkaiba ang grado ng mata niya. Dapat 300 ang kanan, 400 ang
Ay, ako po ba?
nearsightedness can be corrected by a minus lens or what we call a concave lens. Nowadays, due to technology, nearsightedness is now corrected with the very much comfortable contact lenses. Astigmatism is a condition wherein there is an equal curvature of the cornea, wherein there are different degree of curvature from different angles. This is how an astigmatic cornea looks like. It could be flatter on the horizontal meridian or very steep at the vertical meridian. So since there is an equal curvature, there are two foci. So if there are two foci, the brain, central nervous system may be confused which to perceive, the one seen by the flatter side or the one seen by the more curved side. So if there is confusion in the brain, comes the symptom. It is characterized by severe headache, nausea, vomiting, glaring, sometimes tearing, because of the confusion in the brain. And the brain sends message that there is something wrong by sending pain. Okay. Astigmatism can be corrected by lenses, of course. Lenses. This is an astigmatic lens. For astigmatic patients, their eyes are corrected with cylinder lenses. Cylinder. It is a kind of lens wherein the power is different from one meridian to another. As you can see, this side is thinner, the other side is thicker. So this will correct the different curvature of your cornea. The light that passes through your eyes will be adjusted by this kind of lens. I will show you the difference between a spherical lens and a cylinder lens. As you can see, the spherical lens has equal sides, equal thickness in all angles, in all meridians. While a cylinder has a different thickness from the other side. Okay. The 90s, latter part of 90s, a toric lens is invented, is made for astigmatic patients, wherein like the cylinder lens, they have different curvatures. So we call that a toric lens. We call the contact lenses for astigmatic patients toric contact lenses. Presbyopia is characterized by the hardening of the crystalline lens. During younger years, the crystalline lens is flexible. It convexes when we look at near, and it gets thinner as we look at distance. As we grow old, there is little accommodation for the crystalline lens. So above 40, find it hard to see clearly both at distance and at near. Presbyopic patients has difficulty reading, texting, writing, looking at computer monitors because of the inability of the crystalline lens to adjust, or what we call to accommodate. But there is a correction for that. So people don't have to worry of growing old. When patients complain of difficulty when reading, and they move the object farther, that means, and that is one symptom that the patient is presbyopic. When the patient squints his eyes to see the letters clearer, it's one sign that she's becoming or he's becoming a presbyopic patient. Correction for presbyopia is by bifocal lenses, double vision lenses. This is the most common, the regular type of bifocal lens. There are two powers involved. One, the upper portion is for distance vision, and the lower portion is for near vision. But technology has made a bifocal lenses which has no line, wherein it is now called a progressive lens, wherein it's not only a bifocal lens but a multifocal lens, wherein you can see clearly both distance, intermediate, and near vision without the distinguishing line. And that is for presbyopia.
There are also some other cases of eye complications.
Ay, sabi niya, si nanay ay nagbara yung dalo yan. Nagbara yung dalo yan yung buka. Kaya kami nagpapakonsulta. Itzadora, si Aurin. Pinat, 47. Ang mga tulad natin ng babae, talagang lumalabo ng mata, kailangan magsuot ng salamin na gawin ista. Kasi kailangan magsalamin ako. Inatay ko salamin. Tapos binigyan ako ng vitamin sa mata at saka pamata at dahil marunong ang mata ko. Yun lang yun.
So we're going to consider in order, no, the most common visual problem. Of course, what's in our mind is cataract, no, catarata, because it's the most common cause of eye diseases in the world, no, and also in the Philippines. There is around 20 million people suffering from cataract all over the world, no? And around 900,000 to 1 million Filipinos are suffering from cataract. So if we say cataract, it is any opacity of the lens is what we call a cataract, no? So it involves all people, no? From both spectrum, no? From the very young patient to the very old patient, no? You may have a cataract na pinanganak ka as you were born, no? We call that congenital cataract. So if we say congenital cataract, when the patient was born, he has a cataract, no? Because the culprit here is the mother, no? The female, no? The mother. Because during the first trimester of pregnancy, the mother has a disease, viral disease. Especially that viral disease is most of the time is due to German measles. Have you heard of German measles? Okay. German measles, during the first trimester of pregnancy, the mother has German measles. So, pag pinanganak yung pasyente, meron na siyang congenital cataract, no? At the end of the spectrum, no, the old ones, no? As you go older, there's an altered protein metabolism in your lens, no? That's why it becomes opaque, no? Kaya nakakaroon sila ng katarata, no? course, there's only one management for that. And the best management for the people with cataract is surgical intervention, no? Hindi mo na pwede siyang gamutin ng kung ano pa, no? Eye drops, etc., etc. So the best management, if we have a patient with mature cataract, is surgical intervention, no? So another common problem here, the most common na ma-encounter natin in disease is glaucoma. What we mean by glaucoma? Any increase in intraocular pressure is what we call glaucoma, no? It may be open angle or closed angle. If we say open angle, most of these the cause is unknown, no? 95% hindi mo alam kung anong cause, basta nagkaroon na lang silang glaucoma. It may be genetic, it may be unknown, no? While in close angle, the cause is maybe there's a tumor, there's an obstruction on the passageways of the fluid of the eye, causing increase in intraocular pressure. So if we have increased intraocular pressure, the patient develop blurring of vision. What causes the blurring of vision? The increase in pressure, the extra fluid presses on the optic nerve, no? Nasisira yung optic nerve niya. So, there is a blurring of vision, there is a headache as a result of increase in intraocular pressure, there is tunnel vision in advanced case.
It is difficult for us to surpass a day without our vision or has an eye complication. But still, there are people who stay optimistic despite of their condition.
Masaya na rin ako sa ganito. Maigin na rin ang kahit wala kang paningin, may ano ka naman. May pakiramdam at may isip. Tsaka maligaya na rin ako sa ganito. Wala na rin akong mahanap. Talagang ito nang binigay sa akin ng Panginoon. Kung anong pinagalap sa akin, tatanggapin ko. Kaya kung anong nararamdaman ko sa ngayon, ito pa rin. Kahit ako'y para na rin ako nakakaramdam ng liwanag, kaya lang ay kaiba sa ngayon. Kung di mo naman gagamitin ang memory mo, wala. Kailangan may kamay at paa ka naman, nandun ang dapat mong gamitin. Kahit wala kang mata, may nalalaman ka naman kahit papaano. Yan ang nararamdaman ko sa ngayon.